Turning Singapore's war on diabetes up a notch. Steps will be taken next year to ensure sellers display nutritional labels of freshly prepared beverages, including bubble tea. The aim is to deter consumers from indulging in overly sweet drinks and to prevent diabetes, which could also lead to kidney failure. Shalin Sia has more.
Freshly squeezed juice, freshly brewed coffee or bubble tea. If you've been having a tough time trying to tell which one's a healthier choice, fret no more, as outlets will be required to display nutrition labels of these drinks in their menus by the end of next year. Beverages with higher amounts of sugar and saturated fat must be labelled with this Nutri-Grade mark. No advertising will be allowed for drinks which have the highest level.
These measures aim to help consumers make more informed, healthier choices, reduce the influence of advertising on consumer preferences, and spur industry reformulation. I hope more Singaporeans will realize that less sugar will bring out the natural flavors of the drinks, and we may well find them even more enjoyable. More importantly, it keeps us healthy and staves off a very scary disease in diabetes.
Mr. Ong was at a congress on dialysis and kidney failure, a condition closely tied to diabetes.
Singapore has one of the highest causes of end-stage kidney failure due to diabetes. So reducing sugar intake also reduces the incidence of obesity, which is a risk factor for kidney failure as well. So I think this is also part of our war on diabetes to really control that high caloric intake.
To better manage kidney disease, the Health Ministry is pushing for a shift to use peritoneal dialysis or PD at patients' homes as it's more convenient. It set a goal of an uptake of 30% amongst new dialysis patients by 2025, up from the current 20%. Instead of traditional dialysis which pumps one's blood out and back in, PD uses the abdomen as a natural filter.
The freedom of actually, doing it at home without the need to travel to the hemodialysis center. That's the first thing. The second thing is that it does not involve needles or blood. Okay, so there's a lot of patients who are fearful of needles and the handling of blood and all that.
We are developing with our stakeholders a set of pre-dialysis counseling, training, and educational materials to help patients to perform PD independently at home. In April this year, we launched the National PD Home Support Program. And through home visits, specific counseling and support to the patients, it enables them and their loved ones to gain confidence to perform PD at home.
MOH will continue to work with public hospitals and social service organisations to recommend it as the preferred option, unless medically unsuitable.
The initiative is the latest move in Singapore's war on diabetes, first declared 6 years ago. Since then, the government has pushed for healthy living, early detection and also better disease management. For more, let's hear from our reporter, Shalin Sia. Shalin, remind us why diabetes is such a concern here in Singapore.
Now, well, Jill, if we just look at the numbers, more than 400,000 people here in Singapore live with the disease. So it's likely that really any one of our relatives or friends could have it. And for some context, that's almost 1 in 10 Singaporeans. Quite an alarming figure there. So it's no surprise why the government has also called diabetes one of the greatest drains on the healthcare system. It's costing the country more than $1 billion each year. And that could get even worse if nothing's done. The number of diabetics is projected to surpass 1 million by 2050, and that could cost the country $2.5 billion then. So measures have been rolled out over the years to encourage healthier behaviour and turn the tide. That includes making health screening more accessible and affordable, enabling clinics to deliver more holistic care, and like today's announcement, encouraging healthier living and diet.
Well, we've heard it repeatedly being described as a war against diabetes. So for us here in Singapore, how are we faring? Are we winning this war or do we still have a way to go?
Definitely, it's still a way to go. So right now, if you look at the disease prevalence, we're at just about 8% of the population. And you can really see this figure in two ways. One is that it's remained stable since 2017, but that also means that the needle has not really moved. But although we have to keep in mind that any significant results will show up many years later, and this is something the Health Minister has emphasized. There is, however, another concern to be worked on right now: obesity. So it's a key contributor to diabetes, and as we've also heard, closely linked to food and beverage consumption. Now, and if you look across all ages, obesity prevalence has risen from about 8.6% in 2017 to 10.5% in 2020. And now COVID-19 has also thrown a spanner in people's behavior. Many have become more sedentary, and if you think about it, all of us have been staying at home for a many long time. So it's not a good thing if we are to tackle obesity. So Singapore has to continue pushing on, and one way now is through sugar intake.
And we just heard about this new labelling initiative. How will that play a part in the fight?
So now this new sugar labelling is really to help consumers be more aware of the sugar they're consuming. And if you think about it, in the future, every time we buy a sweet treat, we'll know how much sugar and calories we'll be putting in our body. So hopefully that could change some behaviors. And that's in light of some alarming figures that more than half of Singaporeans' daily sugar intake comes from beverages. And we consume on average 12 teaspoons of sugar daily. But now also a reminder that this labelling isn't an entirely new measure, it's actually an expansion of what the government had announced in 2020, and that was for pre-packaged drinks. That will come into effect early next year, but you can already see some producers have already reformulated some drinks. And right now, the average sugar level of pre-packaged drinks has already been reduced from around 7% in 2017 to just below 5% last year. And if you look at the sales of drinks with higher sugar content, they have also fallen, while more people are buying low sugar drinks. If you go to the supermarket, you can see a lot of low sugar alternatives. And then for some context, these results are almost comparable to those recorded in the United Kingdom. And that's really quite significant considering the UK has implemented sugar tax and much more stringent market regulation. So now we'll just have to wait and see, and fingers crossed, if the labelling for these drinks will also bring such sweet outcomes.